students that wanted to be here today and they could not. So I think it will be helpful if we record our session. Okay, so can everyone see our agenda for today? Awesome. So this is what we're going to go over. If you have questions, I encourage you to ask throughout, whether you put those in the chat and maybe Coco and Geneva can help me monitor the chat, or if you want to just kind of speak up, raise your hand, however you want to do it. We want to make sure we're answering all your questions today and making this a discussion. So please feel free to ask throughout. You don't have to wait until the end. Okay, so we're going to talk about kind of a four-year plan, how to get connected and involved in civic engagement. We're going to talk about study habits, asking for help, being kind to yourself during this process. And we're going to go through a little bit of Wellesley data in terms of how our students do in getting into medical school, as well as share that application timeline, which won't happen for you all till a little bit down the road, but it'll be nice to have an idea of what that looks like. All right, so I'm going to go ahead and let Geneva kick it off.
Yeah, so I just wanted to start off by saying that not everybody has the same pre-health journey. First of all of us here are not all pre-med, and even within the pre-med sector, pre-dental, pre-vet, we all have different journeys. So I came into Wellesley not even thinking about medicine like at all. Like I am a classics major and I came in thinking I would do classics for the rest of my life. But then after a lot of discussions with my professors and just my experience at Wellesley in general, I realized that I really love medicine, and I started taking more STEM classes, and I wound up being pre-med. So, life definitely does not go the way you think it will 100% of the time. And everyone has their own strengths and weaknesses. And so some people might be doing more clinical work versus volunteering, which is something that we'll talk a little bit more about later on in terms of requirements for pre-health. But yeah, so I just wanted to start off by saying no matter where you are in the pre-health journey, if you've known since like you were 4 years old that you wanted to be pre-health, that's awesome. If you don't know at all, and are just somewhat interested in medicine, that's also awesome. So wherever you are, that's great.
Yeah.
And the other thing too is that I'm a senior, and by your senior year, not everyone is going to know exactly what they want to do. So I'm a senior and I don't know yet what I want to do for my gap year. I have some ideas and I've been talking a lot with career ed. So there are options, but one important thing to remember is that not everybody goes directly into medical school. So as you can see here, actually in 2022, only 5% went directly to medical school. And nationally, like over 70%. So most of medical school applicants take at least one gap year. And for Wellesley, that's even greater with 90% of our applicants taking at least one gap year. And actually the greatest portion of applicants take 2 gap years. That's for a lot of reasons that we can talk about later as well. But yeah, so you don't have to worry about going direct.
Yeah. So, and we like to tell first years this specifically because sometimes I think the whole idea of squeezing everything into your 4 years can be kind of overwhelming. And it's good to know that it's really common to take a gap time. And most of our students actually do take gap time. So that's why we like to show this graph. We can talk a little bit more about like, what does gap time mean, right? And what am I doing during this time? You're not just kind of hanging out on the couch at your parents' house. You actually are going to be working either in research or in clinical medicine, doing something that's improving your application. So you are doing some kind of work. It just allows you more time to kind of complete the application process. One of the interesting things to know early on is if you want to go direct from undergrad to medical school, you actually start the application process in the fall of your junior year. So it really takes 2 years to apply to medical school. It's a huge process, a long process. So that's why we do see a lot of people taking gap time, because you can imagine what goes into everything in the application process. And if you're doing that while you're in school, that can be pretty tough. Questions about that? So we're going to talk a little bit about the pre-med map. Like Geneva said, there's no one right way to do this. And I can tell you from all the students we advise, everyone is doing things a little bit differently. And I think that's great. So we are just going to kind of take you through some things that you can think about now that are going to help you prepare and plan and be successful in the next 4+ years to kind of be ready to apply to the medical school of your dreams, right? So one of the most basic things we cover when we advise first-year students is about coursework, right? And it's one of the most common questions we have, because of course we all like to plan our coursework, right? And it never works out exactly how we plan, but it's nice to think about, what do I need in order to get into medical school, so that you can kind of create this sequence of classes, right? As you're probably figuring out, some of science classes and other classes have prerequisites, so you have to do them in order. So it's a little bit of a tricky puzzle to fit everything where it needs to be over the next 4 years. So I would encourage you to kind of sit down either with myself or Coco in Geneva, if you haven't already, and kind of show us what you thought of as a plan, or what we can do to help you make a plan, just so you can think some of these things through in advance. So generally speaking, if you're going pre-med or pre-dental, these are going to be some classes that you need. So you'll need 2 semesters or 2 classes at Wellesley of biology with lab, physics with lab, chemistry with lab, orgo-chemistry with lab, right? You need your English class, your first-year English class, as well as one other writing intensive class, which can look like a lot of different things. As long as it's a course that's writing intensive, it usually is good. You want to have a calculus class, a stats class, and then we recommend that you have psych, usually like a psych 101 and a sociology 101. It's good to know that psych and soc aren't necessarily like prereqs classes that med schools look for, but they are on the infamous MCAT. So we encourage you to take those classes so that you're ready for that content when it comes time to take the MCAT. Not everyone does it that way. Some people self-study sociology in particular, but that makes it a little harder on yourself. So the other thing you need is 1 semester of biochemistry. That doesn't have to be a lab for medical school unless it's required for your major, and then another upper level biology. So that's pre-med, right? So that's if you're going the pre-med track or pre-dental track. You also have to consider, right, once you decide on a major, your major courses and how those are going to fit into your plan. And then of course the Wellesley distribution requirements and how those fit into your plan as well. So this is not a complete picture. This is just one part of the puzzle. For students that are interested in other pre-health graduate schools like nursing, PA school, anything like that, those schools are a lot more individualized in what they require. So it's really important that you do your research in terms of like looking up the school you're interested in and then looking up their prerequisite classes. Typically, you would have to add onto this list anatomy and physiology if you're going to go like the nursing or PA route, and maybe a couple other classes. They don't always require the same higher level science classes or as many science classes. But again, that's something that you can either sit down with us and talk about or look at the programs specifically, because there are a lot more for pre-med and pre-dental. This kind of covers most of them, whereas those other programs, they really vary based on school. Any questions on that? See one. And this is something, again, I would encourage you to set up an appointment if you haven't done so with one of us, so that we can look at your actual coursework, what you've done this semester, what you plan to do next semester, and so on. All right. So to add on to all the fun academics you get to do, you also have to do extracurricular activities. So there is 3 areas that we advise you to get experience in order to be a strong medical school applicant. And those are some clinical work, service work, civic engagement, and then some research experience. So we're going to talk about those next. And so Geneva, go ahead.
Yeah, so one of the biggest topics is finding clinical and shadowing experience. So first of all, what is clinical experience? It's basically any type of like patient interaction that you have, any patient-facing interaction that you have. So that could be anything from being an EMT. A lot of pre-med students are EMTs. However, that's kind of hard for us at Wellesley. So there's also something called a PCA, a personal
Here
care
to add on to this extracurricular conversation. So sometimes this can overlap with clinical experience, but what my office does is really the service element. So getting involved in the community, getting experience with different kinds of periphery support services. So we have a few options through our office that are healthcare specific. But one of the things that I always encourage students to think about is to try to get service experience in a variety of ways, to get experience with a variety of populations. One of the things that I think is most important in any kind of direct service profession, whether it's healthcare or otherwise, is to really get experience within certain populations, particularly high need or highly traumatized populations, which in healthcare is going to be part of your day-to-day work. I think it helps to inform both whether it's the right career path for you and to help thinking about
I'm at the present.
a little
I'll
bit.
see lazy to delete it.
So some of the things that you can gain from a service experience are obviously sometimes you get some clinical experience. So for example,
Oh,
we
because
work
I'm
with
supposed to be
Boston
gone, but
Healthcare
I'm
for the
still
Homeless.
here, so I'm still in the field.
Thanks. Boston Healthcare for the Homeless, which is not necessarily a clinical program, but it is within a kind of a clinical organization. And to really build the socialization skills and the personal kind of bedside manner skills that you need if you're going to be working directly with the public. I think that it's also really important for folks that are going into any kind of healthcare related job to get a sense of what social support services people are engaging in outside of the healthcare industry. So whether it's education, food access, community building, housing rights, all of the other things that inform somebody's health and wellness that they'll be bringing into an exam room, say, with you. I think it's really important to get direct experience in. It also, I think, helps with your own self-reflection, your ability to navigate all of the decisions that you have to make when you're heading into a medical health-related career and throughout that process of continuing your education. I think it also helps to understand, again, the social forces in people's lives and what people are bringing into their understanding of their own health and in what's impacting their wellness. So again, there's a few ways to get involved through my office. One of them is just to do volunteering. We have some volunteering spots opening up this semester, and then in the spring, we'll have a lot more in terms of weekly volunteering available. We also are opening up alternative break trips applications soon. So we have one trip in winter session, which takes place at the very last week of winter session before classes start. And then we'll actually have 3 trips during spring break. So each of those trips has a theme. You go with 2 of your peers, so 2 student leaders in our office who designed the trip, and then a group of your peers as well. And you do basically service for, yes, so the cost, there's no cost to participate. Food, lodging is all covered for that time. We're also looking for anyone who has federal work study. We might be able to not reimburse, obviously, for like a full week, but for particular hours during that. So we're kind of working on possibly getting that approved. Yeah, 3 breaks in the spring. And then we're looking to add some additional weekly volunteer slots in the spring as well throughout the semester. And then the other way to get involved in our office is as a student leader. So just like we have some peer career mentors on the call today, we have the Ministrari Council, which involves 6 student fellows who are basically kind of part-time employees in our office. They get a stipend for the year, and they each manage a program area. So Jiyun Che is our health partnerships fellow this year, if you wanted to reach out to her. And then coordinators are the other folks in that group, and they do fewer hours a week, more like 1 to 4 hours a week, and just to get some experience in coordinating partnerships and coordinating student programs, trainings, building community, that kind of thing. More info about the trip. Yeah, so I believe, actually, I'm going to be sending Lainey and some other folks the application link for the winter trip, as I think it just opened today or tomorrow. So it is just freshly opened. And you're also welcome to email civicengagement@gmail.com, or no, at wellesley.edu. I always get confused with that. Or contact myself or Heidi, who's our director, for more information. The winter trip right now is still finalizing their partners because just of the timing of the semester. But I believe that their focus is on reproductive justice and kind of gender-based issues, mostly in the Boston area, I believe. Most of our trips will take place in the New England area to kind of make them more accessible. So yeah, you can reach out to me, you can reach out to the General Civic Engagement account. Jiyun Che, again, like I said, is our health partnerships fellow, but we also have 2 fellows for alternative breaks. We have an education partnerships fellow, we have a volunteer engagement fellow, and then a Metro West fellow. So we have a lot of different programming happening. So it's okay to not really understand each of the pieces because there's a lot of overlapping pieces. And again, I'm happy to answer any questions at the end of the call, or if there's any right now.
Yeah, that's super helpful. One more question, I think. Oh, schedule appointment. Okay. So we can put the link in there to schedule an appointment with us for sure. Thank you, Emily.
Yeah, of course.
So yeah, it's really important that you get involved sometime in the next 4 years, you know, for all the reasons that Emily said, and also because if you want to get into med school, that's, you know, something that you have to do as well, and follow those passions to help you choose what you want to do. All right. Well, sorry about my technical difficulties. If you couldn't tell by my, oh, there's Emily's info. Awesome. Thank you. I have one sick kid that has RSV and another one who's just wild. So they are distracting me, but, yes, I put the link to the presentation in here in the chat, as well as Emily's information. So you can open it there just so that doesn't happen again. But I'm going to go ahead and turn it over to Coco. And if Coco, if you just want to get on and kind of talk a little bit about your research experience, because that's the other area we kind of want to tell students about is research. And we get lots of questions on how to do research, how to get involved in research, and all of that information.
Yeah, of course. Like Lainey was saying, research is a huge part of the application, and there's so many different ways that you can get involved with research on campus or off campus, research in the sciences, research that's not in the sciences. They're all valid. There's plenty of programs if you're interested in focusing on research on campus. There's plenty of programs through the Science Center, many of which Geneva and I have participated in, so feel free to come talk to us about those. First year specific programs, there's the first year apprenticeship program. I believe that application has already passed, but as rising sophomores, there's the sophomore early research program, so come talk to us about that and starting your application for that. In the spring semester, I know they do biochemistry research week. If that application is still going, I did that program and I would be happy to talk about it. It's great. And then also in the spring, the application for the summer research program in the Science Center with the Science Center is also going to be opening. Geneva and I have both done that program, and we'd be happy to walk you through the application process, talk about our own experiences and things like that. Another way to participate in research that may not be on campus is doing a UROP at MIT. I worked at the Language Acquisition Lab at MIT my first year spring, And I'd be happy to walk you through that process. It was a great opportunity. I really enjoyed it. I ended up staying at Wellesley for research, and I can talk about kind of the pros and cons between Wellesley versus MIT or Wellesley off campus if that's interesting and helpful to you. But yeah, those are two of the broad categories. You can also just reach out to professors that you've had a class that you enjoyed, or you can reach out to professors whose research you're interested in and talk a little bit more about maybe joining their lab as a volunteer or for pay or credit research. And then there's also, as you'll see in the Canva, there's also a lot of opportunities for summer programs through AAMC. You can look at their list. And I know Geneva also has a document that we've kind of been working on that we'll send out at some point with a list of summer programs for shadowing, so clinical experience, research, and volunteer.
Yeah. And what year did you start research, Coco?
Yeah, my first research experience was actually, I think, my year up at MIT, my first year.
Okay, great. And what about you, Geneva? Did you?
I started my sophomore year through the sophomore
Okay.
early research program.
Okay. Yeah. So I just wanted to ask them because oftentimes I get the question from first years is like, when should I start research? And kind of how, and Coco did a good job of giving you different suggestions. Anyone have questions around research? You definitely don't have to start as a first year, I should say that. You just want to obviously sometime throughout your time at Wellesley, get some research experience. And it doesn't have to be like wet lab research. If you are interested in women and gender studies and psych and in something else, you're more than welcome to do research in those areas as well. So it's more about the experience, more about you finding something that you really truly have interest and passion in. Okay, so there's a question I think oh, Geneva, perfect. You were emphasizing that. I love it. Very good. So research questions. Yeah. No, we're good. Okay, we can always ask questions at the end too. All right, so I'm going to try to screen share again and try to not show you my.
Oh, we have a couple of research questions here.
Oh, awesome.
So how does credit research help our applications?
So it doesn't matter if it's credit or non-credit research, both are really great to have. So you're talking about like research through coursework, basically. I mean, I think that is a perfectly justifiable piece of research. It kind of more depends on like what you're doing. And as long as you can take part in that research and you can speak to that when it comes to application time. Does that help answer your question? And then what exactly? For the second question, are you talking about the for medical school application? So on your medical school application, so they're looking for those three areas we were talking about, right? So they're looking for research experience, clinical experience, and volunteer civic engagement experience, okay? So when it comes time to fill out your application, you are going to have this wonderful document that allows you lots of space to talk about all those different things. And so it's really not about the number of hours you have in any of those areas. It's more about, even if you have one research experience, that's totally fine. It's more about, again, the quality of the experience, right? So what you're doing, what you're learning, how it's helping you develop as a human. Medical schools are taking the holistic approach. They want to see who you are, not just checking off boxes. So I think it's important to know that it's more about like the quality of the experience. I think oftentimes students start a research project and they end up loving it. So they'll continue on and they'll do it for a year, or maybe they'll jump onto another research project. So I think it always opens doors as well to kind of continue, but it's not something like you have to have this research, a certain amount of research. You certainly don't have to have a research publication, although some students do, right? And some students strive for that because personally, that's something that they want. If you plan to go to an MD PhD program, that's a little bit of a different story. So that in that case, you would want to have a little bit more research experience, and we can meet and talk with you about that. But if your primary focus is going to be like research based, you probably do want a little bit more experience with research. But if you're going to work as a clinical MD, you don't have to have these, anything other than just some research experience. And that comes to play when you're writing your application, writing it out in essay form, writing it out in your documentation, and then interview time, they will certainly ask you about your research experience. Coco and Geneva, do you have anything to add?
Yes, I think Aaliyah was also asking what's the purpose of research? Why do
Mm,
medical schools want us to do
yeah.
research, essentially?
Do you want to answer it?
I can a little bit, but I think you might be able to
Okay,
provide a
well, you
better
start.
answer.
Go ahead.
For me, I think part of it is, medicine and science are very tied together. A lot of medicine is, reliant on research. And so part of it is a lot of doctors end up doing research, even if they aren't MD PhDs, they end up doing research eventually, just because they realize that it's so integrated in their work as well. So that's one part. The other part is being able to ask a question and then follow your curiosity about that question and carry out some kind of plan to discover some findings, not necessarily answers, but findings. And I think that experience is very valuable, especially when it comes to medicine. When a patient comes to you, they don't necessarily know what their condition is. So they might be saying, I feel this, this, and this. And you have a hypothesis. Maybe I think you might have this condition, but let's test it out. Let's give you some prescriptions. Let's see how this goes. So I don't know if there's another additional layer to that admissions is specifically looking for. So Lainey, do you have anything to add to that?
No, yeah, no, I think that's great. At a very basic level, they want to know that you can read and understand scientific research, right? So you can, as a doctor, stay up to date on all things that you need to in your specific area of your specialty, right? So you don't, unless you're going for an MD PhD program or you're going for an MD program that has research involved, you don't do a whole lot of research in medical school. It's more about understanding the research process, understanding how to read research articles and things along those lines. So that's very different if you're going to a PhD program where you'll be doing lots more research. And it's good to have research for dental school as well. If you're interested in nursing, PA, those types of programs, you don't necessarily have research, but it never hurts to kind of get involved and have some research experience as well. Good. Did we catch all the questions? I know that research is a big one. Anybody have any other questions about that? Awesome. Okay. So I'm going to screen share. What do we think? All right, I got it. I'm leaving it there. All right, we are going to next hear from one of our academic success coaches. She's going to kind of talk you through study habits and establishing a strong kind of foundation. And that's really one of the things we emphasize for first year students in particular. There's so many things to think about with pre-med, right? So this year you really want to say, academics are the most important, right? How do I create a strong foundation for my Wellesley education? That's kind of going to build throughout my 4 years. So Marcella, do you want to take over?
Yes. Hi, everyone. Well, Leah also already introduced me. My name is Marcela. I am one of the ASCs working for Freeman. I live in Bates, but I work for Freeman. I'm also an international student. I'm a sophomore. And yeah, well, basically, I just wanted to give you a brief description of ASCs. ASCs are academic success coaches that we are all located in every single dorm. If you live on Tower or in Severance or Clavin, you will have an ASC. So I'm just here to represent them, but you can totally reach out to me or reach out to any of them. We usually work with students answer academic related questions, focusing on high impact study skills. We also work with you to talk about test management, academic planning, or even we also help out writing emails. Sometimes it can be a little bit intimidated to write emails to your professor, so we'll help out with that. Right now, I'm just here to talk to you about a little bit of study habits. However, I'm just gonna go briefly to that because I also want to see how you guys are already doing. as like all the presentation, one of the main things that I think like we all got is like pre-health students have a lot of things to do. We have to do clinical research, you have to do research experience, we have to have all those classes. But like, do we really think, how can we manage all of that? How are you guys managing all of that? So I'm just like want to ask like question for like everyone in here, if you guys can like write it like in the chat, or you can say it out loud. How have you been like keeping track in all your classes and activity? What kind of resources have you been using so far? I don't know, like besides Google Calendar, of course, what resources have you guys like been using? It could be like, I don't know, Word, Excel,
Mm.
Wolseley agenda. That's good. Mhm. Another thing, like I know a lot of people uses Google Calendar, but like that can be helpful. Google Sheets, stickies for keeping track of assignments. That's good. Then Excel also, like I know like you can just like put all your like assignments, the due date, and then you organize all of them. Well, like it's really good at all of you. Like I like just a few examples, but I see like most of you, Google Docs, most of you are using this kind of like organization methods. But I just want to be here and like talk to you about maybe like thinking from like big to small. We can start planning like the big events first, and then we go to small. Like we can like, for example, use sticky notes or Google Docs and see, so I have to do this assignment for this day, I have this assignment for next week, and then I have to do, I don't know, organization or org meeting, and then I have to do research. But how do we start tracking all of that? I will first recommend you to have like a big planner, like a weekly or monthly planner that you have. We have some of like the monthly planner, like a semester and a page and a PLTC that you guys can go, which is in the third floor in the club library, that you can have like a huge like view of all the semester. Then you can put like first the big dates, like for example, I have an exam of chemistry due, I don't know, November 1st. Then I have another exam that is actually the same week. So how am I going to manage my time for having two big exams? And then I don't know, I have like event like from my org. So I have all of these things in the same week. I will be able to see that with a huge calendar, so I know how to like manage my time beforehand. So first let's go big, and then we're gonna go small. After that, if you have a planner, it could be like your Google Calendar, it could be like a physical calendar that you have, or I don't know, in your computer, you can have like Excel sheets and like start putting like, I have this due, I don't know, November. I always use November, but yeah, you will have all these dates set first, and now we're gonna go a little bit smaller, which is your weekly planner, like weekly, sorry, weekly. English is not my first language, so I'm gonna make sometimes like mistakes, but just let me know. Um, then we go weekly, and then we're gonna see. So first, you're gonna set all the times that are like you cannot change them. Like for example, classes. Classes are gonna be always first, because of course you need to go to your classes. For many like 1,000 classes we're gonna take as free health students. Then we're gonna be like adding, for example, commitments that we have. If you guys are in different orgs, like for example, I'm in Slater org, you can put that like I have a weekly meeting every single week on Tuesday, so I cannot be sad. And then if you are able to like get into research, there are like the research weekly meetings. There is your time in the lab that you have to add as well. So those are the big commitments that you have to put in your weekly calendar. So we're like seeing the view of our time management in like a week. And then we're gonna be able to put like the study time. Something that I heard like some students asking like, how much should I study? It's like, it's not necessarily like a simple question, because I cannot tell you, okay, you have to study 10 hours per day. It's not necessarily like that. One can start building certain study habits that can work for STEM and humanity courses, because they tend to have like different approaches, like different homeworks. In the STEM course, you're gonna have P-sets, you're gonna have like some review before class. In a humanities, like more like discussion-based class, you're gonna have a lot of readings that I don't know if like you guys are like able to like read in like not too much time. I take like hours reading. So I have to like manage my time, how much I'm gonna like invest in this reading. So we're trying to like, I cannot tell you how much you're gonna like spend on studying, but I will tell you, for example, first you do a preview of the class before the class. then you do a study of the same, like if you have a class on Monday, then you do like the study of the notes that you have on Monday, and then you do a review after that. So you will have like 3 cycles that are not in like the same class. And that's something that you also have to add to your calendar. That is not, that doesn't have to like be, okay, Monday, I have to do all of this, all of this. I just have to like cram all of the homeworks that I have. But let's like start like talking about kind of the study cycle. So review, like preview, the review the notes, and then you study based off the notes. Then also, if you, for example, go to your weekends, let's try to think the weekends has like 5 blocks of time. So for example, you have Friday night. What am I going to do on Friday night? Then you have Saturday, you divide in 2 blocks, and Sunday as well in 2 blocks. So from those 5 blocks that we have from Friday, Saturday, and Sunday, what we can think of is like 2 of them can be for yourself, 2 of them can be for work, and 1 of them can be for like fun activities, for example. I just like want to know, like, want you guys to let you know that it's good, it's okay to have 2 blocks of time for yourself, because before being a pre-health student, you're a person, and a person needs time to sleep, needs time to eat, needs time to socialize, meet with friends, or watch any series on Netflix. So the idea of like time management is to be able to accomplish all of what you have, but not necessarily like not I don't know, like going to sleep at 2 a.m. or waking at 5 or having to do all your stuff like during the weekends. And basically that's all I like wanted to say, but also just want to remind a few things as well, that all of like WELSI students, maybe you're already noticing, is that WELSI students are overachiever. We tend to do a lot of things because we want to do the best, and that's okay. But that doesn't mean that we have to do everything alone. Like one of the things that could work for you as well is working in groups. I don't know if like you guys have already tried like working in groups for like a piece set that you have to submit, but like working and relying on other people can help you out as well, so you can like manage the time with all of them. And like reaching to like professors, and like Oko is gonna like talk about that, who do you have to ask for help, just like a little preview about it. Always have to reach out to for help for like professors or like classmates, so you know like who you can trust, like who can become your mentor, because sometimes we don't know like all the answers. And I know this is not too much related to like time management, but of course like it is more like ACs are not only, oh, I'm gonna give you like the best study strategies that you're gonna have, but we're also here to like help you to reach out to resources that you have on campus, like professors, go to office hours, or I don't know, if you have problem with accommodations, we can also reach out to ADR. We can reach out to Stone Center. We can help you reach out to the dean if you have like, I don't know, certain situations that we understand, because we are able to help you, as we are like a messenger in some way between the student body, and the faculty here at WELSI. I know that I talked too fast. I know that. So I don't know if it was clear what I wanted to say. If you guys have any questions related to ASCs, or like also you can let me know. I have like, let me send you quickly the link for the PLTC Center.
Yeah.
So you can like have more access to handouts that we have for like note taking, memorization, how much, like when should you start like studying for exam, or you can also like see like the different contacts of the PLTC like faculty staff. They can help you as well, like to maybe have a meeting if you have like more questions that you have about a PLTC, like the tutorings, the SI hours, or the coaching hours. You can let us know, and you can like, I send the link right now. Yeah, I don't know guys, if you have like any question that you want to ask in general.
Study questions. Anyone have any study tips they want to share that's worked for them? Nice. And we'll emphasize this a little bit at the end of the presentation, but you don't need a 4.0 to go to med school. It's always something we tell students. We'll give you some of our average data, but yeah, definitely study habits are important to develop early, right?
Yeah. Also, like, just wanted to remind you guys that at least that right now, most of your like first year in the first semester is shadow graded. And it's going to be amazing that you're being shadow graded, but that doesn't mean that you have to like, oh, that doesn't matter, like my GPA doesn't matter right now. You have to start building like study strategies now. Don't be too hard for yourself, but try to start like knowing how do you work in a college level class, because it's completely different being in high school to college. You don't know, like in high school, usually all your time is like already scheduled for you. They're gonna tell you you have to go to this class at this hour, and then this is what you're gonna do in the rest of the day. But in college, you don't know exactly what you're gonna do. You can be one day like, I don't know, in the PLTC, another day in Clap Library, another in UITS, or like you have to start organizing more, like being more, I don't know how to say this word, autonomous. Okay, doesn't matter. But you have to be more independent with your time and see how do you work best, what time do you work best as well, and what resources or what type of like approaches you can take for a certain class that you struggle with.
Great. Thank you so much. Any other questions? Awesome. And the support is out there, and that kind of like segues into our next topic. So Coco, if you have anything to add about if you need help, ask for help, right? So certainly we can provide advising help, but also getting help from faculty, from tutors, reaching out to people. I know that can be intimidating sometimes, but people are really here to help. So Coco, do you want to talk a little bit about asking for help if you need it?
Yeah, of course. And then also, in addition to everything that you mentioned, going to office hours, and even if it's just in class help, professors I found, especially at Wellesley, are so, it could be intimidating, but are so nice and want to help. Use the extensions that they give you. If you have flex days, you could put them off to last minute, but use them if you need them. Don't be afraid to use them. It won't count against you. I know they do flex days in a lot of classes, but don't be afraid to be honest with your professors if you're struggling. A lot of times, I know Geneva tells this story, and I had a similar story where we've set up separate office hours for us individually, especially in chem classes. This is my Chem 205 class. Separate office hours with the professor. She was nice enough to do that for us outside of her regular office hours with everyone, to help and catch us up and make sure that we were on the right track. So people are willing to do that for you, and they want you to succeed.
Awesome. Yeah, thank you. Any questions about that? Again, these topics kind of flow together, so it's nice. So one of the things I wanted Geneva to talk about, and I know she has to leave soon, but is about not comparing yourself to others, right? So along this path, of pre-med, there's a lot of people doing a lot of amazing things, but also you want to make sure that you're trying not to compare other people's journeys to your own. So Geneva, can you talk a little bit about that piece?
Yeah, I just want to say, like, this kind of ties into what I was talking about earlier, how everybody's pre-health journey is different. So some people might have a lot more clinical experience than other people. Some people might have a lot more volunteering experience than other people. So it's really important to not compare yourself, because you have your own strengths and weaknesses and unique things to bring to medical school or whatever pre-health profession that you want to go into. And oftentimes the things that you think about other people are what they think about you. So for example, like when Coco and I first met each other, I found Coco a little bit intimidating because she was like doing all these things, and I thought she was really cool. And I was like, I mean, she is really cool. But I was like, wow, like how does she do all of these things? And she's like only a sophomore. When we met, she was a sophomore at the time, and she's only a sophomore. So how does she do it all? And then like Coco and I had a heart to heart, and she was like, oh yeah, like I see that you're really busy, like doing all these things too. And so it's kind of funny when you start talking to other pre-med people and you realize like everybody's but you realize that everybody is everybody is doing something. Everybody is also feeling like you, like they're also feeling a little bit overwhelmed with all the things that you have to do for pre-health. They also think that you're really cool. I guess Coco found me intimidating as well. So definitely Anytime that you feel like, imposter syndrome or anything like that, just remember that like anything that you're thinking about somebody else is probably what they're thinking about you too.
Yeah, I think you're right. And that's a tough thing to do. So you have to like keep reminding yourself of that, right? Of you're on your own path and your journey. And believe me, I know from seeing students that are like at the end of their journey, everyone goes through different things. It's all kind of a different path people are following. Awesome. So Coco, can you tell us just real quick about like taking care of yourself with all of these other things we've told them to do, right? How can you take care of your own wellness while you're trying to accomplish so much at Wellesley?
Yeah, I really liked what Marcy was saying about that 5-day block weekend sort of thing. It's definitely really important to make sure that you take time for you to kind of rest and recharge. Without sleep, it's not good. Like you can't succeed. I remember talking to a psych professor about this and how necessary it is to get sleep. So it's really important to just take time to relax. Make sure you're getting at least like 6 to 8 hours of sleep, doing something that you enjoy, having hobbies. It's hard with Wellesley's schedule, but I really liked that like 5 block weekend. I'd never really thought about that, or like my weekend like that until now, actually. So I might incorporate it.
That was a good tip, right? And 6 to 8 hours. Whew, I need more than that, I think. At least 8 hours here. But no, I think that's really important. And taking care of yourself is going to look different for everyone, right? So you kind of have to find what works for you. But that is definitely a piece you cannot leave out because you'll burn out, right? So burnout happens very quick and kind of sometimes unexpected. So you want to make sure that that you're taking care of your wellness. Questions there? Anybody? Good. Okay. So for the last portion, I know we're kind of running low on time. I'm just going to go over some Wellesley data just so you know kind of like last year how our students did in the application process. This is just, just kind of interesting to know. It's not something that we want you to feel any pressure from or anything like that. It's nice to know that going to Wellesley, getting help from our advising team, working with our students allows you a really good chance of getting into medical school. We have about an 80% acceptance rate, which is great. And our students go all over the country. So this is a list of schools from 2022 applicants. It's going to look a little different every year, but you can see that students really go everywhere. So once it gets to that point for you, you'll be making a list of dream schools and also some state schools from where you're from and, maybe some others as well. So you don't have to worry about any of that now. It's just to let you know kind of the possibilities are out there. The average schools students apply to medical school nationally is about 18 when they go through the application process. It's another fun fact, although a lot of our students apply to more than that as well. So this is the slide and you don't need a 4.0. For medical school, sometimes students get really worried that they don't have the GPA they need. It's really important for you to understand that it really is, honestly, we're not just saying this, a holistic application approach. You're going to be writing about yourself, about all of your experiences. And yes, they are going to be looking at your GPA and your MCAT score, but they're also looking at everything else. So these are just some numbers. In 2022, the average Wellesley science undergraduate GPA was a 3.69 and then cumulative 7.2. So that's kind of your overall GPA is your cumulative. And the reason we pull out science is because they actually do that in the med school application process. So they'll look at your science GPA separately than your overall. So you can see, it's much more doable than a 4.0. So don't panic if there's a class or two that you're feeling like, oh my gosh, this is really hard for me and I don't know exactly what my grade's going to look like. Most likely it won't ruin you. So we just got a question in the chat. That's a good one. So I want to address it. So she asked, so that some school, or she heard that some schools ask you for shadow grades. So not in our experience so far have schools asked for shadow grades. So when you apply to medical school, we help you kind of with your application, and we submit a letter from Wellesley that talks about all the things Wellesley, including shadow grades and why we do them. And they're very widely accepted. Lots of schools do them. And a school wouldn't be able to go back and see those grades. The only time that that's released is like if a professor writes a letter of recommendation, then they are allowed to like write how you did in the class in that. And if it happened to be a shadow grade class that you want someone to talk about, they can share your grading then. But otherwise, they really don't look at those shadow grades. So they can't be uncovered in any way. It won't be, at least in the time that Cindy and I have been here, that hasn't been an issue at all. And like I said, it's very common, and medical schools are really aware of it. Okay, so this is just, I know it's hard to see. It's on our website. So if you haven't been to our career education health professions website, has so much great information on it. One of the biggest things you can do today is sign up for our newsletter. Just like I emailed out the information about this session, we email stuff out for pre-med, pre-dental, pre-health profession students once a month. It's great information. You can sign up for it on Handshake. And then as well as that, we have a lot of information that you'll be using down the line when you apply to medical school. And one of those things we have are a calendar of the application process. So we get a lot of questions about like, when do I do what? If you work with career education, we totally walk you through that process. We just had an application kickoff, which Geneva took part in because she's starting the application cycle. And so you'll come to that. We'll make sure you are well aware of everything that's going on for the beginning of your application. So this is on our website as well as here. It kind of goes through what you'll be doing during the application cycle. The only things you really need to know now is it is about a 2-year process. So it's good to think about now what that might look like for you if you're going to be taking gap time or not. And just making sure you get in all your prerequisite work before you would be applying and taking the MCAT. So if you go directly to medical school, the latest you could take the MCAT would be the spring of your junior year. So again, that's just like another good thing, good fact to know early, is that that makes a difference in course planning, right? To have everything done that quickly. So any questions about that piece or anything you want to add, Coco?
I think you pretty much covered it. I don't have anything else to add, but I do see another question in the chat about if we want to go straight through to medical school, when should you take the MCAT?
Yeah, so just like I was kind of just addressing, so you take the MCAT usually in your applying year, although it varies for people. Usually, students decide when they want to take the MCAT based on like when and how they can study. So kind of creating a study plan and then choosing a date based on that. But the latest you can take it is April of your applying year. So in the case that you wanted to go directly to medical school, that would be in your junior year. So you want to try to get all your prerequisite work done before you take the MCAT. So that's kind of another reason why you see a lot of people taking gap time, because the direct plan is just, it's crammed. A couple people are leaving. Thank you, Emily. Thank you, Geneva. I know you have to take off, but yeah, hopefully that answers that question. As far as research and volunteer work, you just have to have that all done by the time you submit your application as well. You can continue to do that work and you can add on to your application. You can make edits to it, but you want to have the bulk of it done before you apply. And then what subjects are the hardest on the MCAT is such a hard question to answer. That is basically, it depends on you and what your best subjects are, I guess. So in the MCAT process, one of the first things you'll do is you'll take a diagnostic MCAT. That's what they call it. They offer it for free through the AAMC. And you will take the full length practice test. After you take the full length practice test, that will give you a really good indication of where you are, right? So what areas you need to really focus in on, what you are already really doing well at. So that's kind of a good indicator for you, and it'll tell you what you need to do more work in. So that's really kind of the starting point for MCAT studying. But I wouldn't take the diagnostic until you're kind of starting that process, because they usually only can take one free one and then you have to start paying for them, which is never fun, right? All the medical school stuff does cost a lot of money. Okay. So the diagnostic included in the application. So the diagnostic that's free is through the AAMC, which they also have other programs like Princeton, Kaplan maybe, and Blueprint. They have their own diagnostics. They're probably not free, but it's not included. Like the diagnostic is kind of a separate thing. The MCAT is a separate thing than the medical school application, if that's what you're asking. So you have to pay for and take the MCAT, and those scores will go to the schools you apply to, and that's separate than your actual like application you'll be filling out with our help. Does that answer your question in the chat, hopefully? Awesome. Any other questions? I know we're kind of running out of time. I did want to share with you Coco and Geneva's office hours, because as you can see from this presentation, they're so very knowledgeable and helpful. So they have walk-in hours, so walk in virtually or in person, but you can come any of these times. I didn't include the link to your virtual hours, Coco. I don't know if you want to throw that in the chat.
Yeah, let me find that.
It's on our website, but yeah, and you can just drop in during these times and just kind of brainstorm with them. They have lots of great tips and experience. So they're pretty awesome. All right. Well, I want to be mindful of your time. I certainly can stick around. Anybody have any other questions, anything they want to know? I would encourage you to make individual appointments with myself or Cindy on Handshake. Cindy is our director, and I'm our assistant director. So either one of us hopefully can be very helpful to you in your one-on-one questions that you have. You're welcome. All right. So I'm going to stick around if anyone wants to ask any questions, but otherwise have an awesome night.
I'd love to ask a question real quick. If I am looking to schedule out like a 4-year plan right now, who should I talk to about that?
Yeah. So you can either book appointment and Handshake with me.